So thank you to Yossi for inviting me for this talk, and it's something which we as young ophthalmologists really need to know. That is how to incorporate simple innovations into your practice. How and why? So I have no financial interest in this presentation, but a few of the apps which I mentioned have been made by myself. First, let me just talk about how I had all this engineering stuff in my profile. So I had always been from school days a programmer. I have been always interested in the engineering side, the computer programming side, and I've programmed with all these languages: Logo, Turtle, GW Basic, Q Basic, C++. But I had to take up ophthalmology, family practice, so I ended up being an ophthalmologist, but having all these extra things on this side. Even in medical school, HTML, JavaScript, we made a website called Medico Zone for PG entrance preparations and all that. We had a actual forum over there in which we had people coming in and joining and prepare for the postgraduate exams. And I had also done some programs in Flash and ActionScript, which is supposed to be for animation, but I made a surgically induced astigmatism calculator because a postgraduate in ophthalmology there knew that I was going to be taking up the ophthalmology, and her thesis had some issue because the software which you were supposed to use was not working. So being the tech support guy, there, I was asked to help with opening the software. I realized the software is corrupted, so we just sat and made a new app then and there. And of course, period of gestation calculator, that was during my OG posting. We were told that we could, as final year PGs, we could finish the calculation of period of gestation and EDD for all the patients there, and then you could go for T and come back. So we just automated the process. We never told the OG PGs what we were doing. So from my batch onwards, all the people, all the MBBS students posted there were going for tea very early, finishing off all the work, going for tea, having a lot of time to chit chat and come back just in time for the class. So that is what we did. And residency days, of course, iGrader app for all the grading systems. I know Tamil because when I was in Arvind Pondicherry, I found it relatively okay to learn Tamil, but I found people from many other places who found it very difficult to learn Tamil, including people from Kenya and many other parts of Africa. They came here because, like Dr. Aati said, there are very few doctors, very few ophthalmologists there. They needed to learn as much as they could in a short time. So Tamil was very difficult for them. We made I Know Tamil, I Know Bangla. So these are the apps for communicating with the patients in these languages. iDoctor, JD, 3D Atlas of Ophthalmology. These are all the apps which I made during those days. Coming to the clinical practice, in a typical eye clinic, you have the history taking, general exam, vision, eye exam, anterior, posterior, and the other tests. So what can you do in these things? So necessity is the mother of invention. During the COVID lockdown, we had a lot of problems with social distancing. So there are some apps which we could use during that time. We were trying to reduce the direct contact, reduce this thing. So patients were asked to before meeting the doctor itself get a history done on a what sort of complaint they had and all that. And language barrier, we saw the apps which I had mentioned just before, and these are things which I have not incorporated but could be used in case of the situation arises. You could take pulse rate on a standard phone. Of course, you can do it on a watch which has a pulse oximeter, but if you don't have any of those things, you can still take the pulse rate by using the smartphone apps such as this. And there are things which can look at the images and grade the icterus and anemia. Not really use it myself, but definitely something which could be done in, so suppose you are in a place like Tanzania and you don't have any other support, you could use these apps to get a general idea of what the situation is. And of course, visual acuity, there are these charts. You could use an iPad and an iPhone and use the iPhone as a remote control for the iPad, and that would be a vision chart in itself which can do all these tests. So this is something very portable and you can use that. Then of course, the peak acuity app, they made it very easy for illiterate patients to be analyzed. So you just ask them which way is the E pointing, and you just slide the finger in the direction which they said, and that makes visual acuity testing very easy to learn, do, and also to teach others to do. So I think you might have found it useful in some places to take visual acuity with a peak acuity app. Stereo acuity is something which is not easily doable, but there are apps which can do that. If you want to get stereo acuity testing devices, they are very expensive and they are very used very rarely. So spending so much for something which is used very rarely, unless you are a super specialist who is going to do all this 3D testing. So this is something which can use. You can use a random dot stereosis testing app, the NTU RDS screening app. And refraction also, if you do have a full set refraction with you, you use that. But then these are the things which you can use, the smaller, portable, less expensive ones, and these can definitely help you in your practice. Ocular examination, you can do measurements by using these things. So this was what I had presented way back in 2018 and in TNOA. So there is an app which we could use to do the measurements if you have the scale on there. So you just have a reference marking and you can measure anything else in the picture. And of course the eye positions and the head tilt, eye tilt, all those, the 9 gaze, everything is an app nowadays. So I'm going faster as the time is short. Anti-segment photography is something which I very regularly use. I use it to counsel the patients. So I take a photograph, show the patient, see, this is what you have. That really helps when you're new into private practice and they see that you don't have any gray hair and which you are a junior doctor, what do you know? So you take a photograph, show them, and that really helps in the patient rapport. And of course you can use all these devices. There's the IOL which is used for the ASPE. Dr. Prithvi Chandrakant has used the discarded IOLs for photography. Dr. Nilesh Kumar for gonioscopy. You have the DIX Pro, and the toric IOL marking is something which as a young ophthalmologist stepping into private practice is not something that you can afford to buy the Varion or any of the expensive gadgets. So learn to use the apps, the free apps. Dr. Saurabh Patwardhan has one, and of course there's iToric Patwardhan, and of course there is one by Dr. Jitendra Jetwani. Yeah, there is the one Jet Bros. So all these apps really help you to go into the premium IOLs, the toric IOLs, without spending too much money on the gadgets. Fundus examination, you can of course avoid taking a new fundus camera until you can afford it. So you can use a fundus camera such as the foldable fundoscope. This of course is the first version. The latest version has inbuilt illumination, magnetic docking and all that. So that is something which you can definitely use for your private practice. You can do it in your clinical practice. And keratometry is also possible. It's not very accurate. So there is something which I did called Keracan Mini Top, which can be used for getting a rough idea of the topography, and it is still under further development. But yes, this is also something you can have. Perimetry, we had the virtual reality perimetry. We started it in Arvindai Hospital, Pondicherry, with a regular virtual reality headset, which is not very expensive. So less than 1,000 rupees plus a phone with a Bluetooth clicker. So we use a Bluetooth clicker just because we had it, but we could even put in a earphone, the wired earphone. Those days the phones had something called a 3.5mm jack. I don't know if you guys know about it. So that could be used to feed in the input to the phones, but you can do it with Bluetooth nowadays. So all these were things which were very low cost, very frugal innovations, or frugal innovations, as Dr. Santosh Hanover used to put in the IJO. And of course there are some more things which I do have some more time to use. Yeah,
you do have time.
Yeah, so we have put up several things in 3D models. I have designed these and put it for free on the NIH website. So if you scan this QR code, you can go to that website. Over here is the National Institute of Health USA's 3D website, and here is the Thingiverse. It's a general purpose 3D website. You can download these designs and print it for yourself. You don't have to know anything much about 3D printing. You just need to know how to use Google Maps. Google Maps search 3D printing shop near me, go there and tell, "Arey bhaiya, I want 2 printouts," and just tell them print, download, print. 5 copies. So they'll print and give you these things. So these are not paper, these are plastic models, 3D models, which you can use. My idea is that you can use these in the wet lab. So that will be the first step. You use these in the wet lab, but there is a step 0. You can use these in your PowerPoint presentations. There are these new PowerPoint things that you can use 3D models within the PowerPoint itself. The same thing which you can 3D print instead of so if you don't want to 3D print, if you don't have the you can just use it in your presentation. So if you notice here, these are 2 3D models which I put, and look at the next slide. They just move in 3D. So you put it there, put it in morph transition, you can transition them. So yeah, you can use this for your 3D presentations as well. And then we printed some new designs of glaucoma drainage devices. So all these can be used for innovating new designs of any ideas that you have. Suppose you have an idea for a Divakant chopper, but no, you're a postage segment. So you want to do a Divakant peeler. So, so you make a Divakam peeler, draw it on paper, then you draw it in 3D, and then you print it out, test it out. You figure out what works, what doesn't. Then you realize that okay, it needs to be having a bend at this point, and maybe the bend is not enough. So you iterate, and then once you iterate, you can again redesign, print it, redesign, print it, find what works, then patent it, and then go to the company and get it done. So that's how you can do your innovations, make it from a dream into a reality. This is a very interesting case. So I was in Ramchandra Medical College during the COVID lockdown. I learned 3D designing, and I had all these MBBS students there who some of them were interested. So I taught them not just Ophthalm, I taught them 3D designing, AI, smartphone, so many things. And they came to me, told me that they want to do a project. This was one project which I made them do. I asked them to search for something. They searched and said, "Sir, we saw something called punctal plugs. Can we do that?" So I said, "Okay, how can you make something innovative from that?" They came up with the idea. They drew this 3D design themselves on their iPads, and we 3D printed it, we published it, and all these things could be done. And this is the glaucoma drainage valve, the RD equivalent which we printed. We practice surgeries using that. And that helped us in their the GDD surgeries, and all these things are available. Of course, there are so much more to talk about apps. I don't want to waste more time on that. But if anybody wants to, if this is the recorded thing, you can just pause the video. So I'm going through it. Tuck, tuck, tuck. Yeah, pause the video and look at it later. So thank you for listening to me, and thank you, Yossi, for this session.
Thank you so much, sir. So what is the app that you use to design these 3D models?
Yeah, so there are several apps which you can use. I use the free software, free and open source software called FreeCAD, and that is something which is not very great, but that is something which I use to develop all the models which I have shown here. And if you want something slightly better, there's something called Fusion 360 that is technically free for students. So if you have a .edu email address, you can get it for free, or you know where to get it for free. And you can always use several other software. One is Rhino. Rhino is also pretty good, RHINO. And yeah, you can use SolidWorks, you can use AutoCAD. But if you want to have the officially free one, FreeCAD. And
so even Windows 10 and Windows 11 has a Paint 3D, which comes pre-installed, and for simple 3D diagrams you can use that and import those images in PowerPoint also, the way you were showing.
Right. And speaking of free, so have you considered monetizing, or are you monetizing any of these innovations?
I am monetizing the 3D printed fundus camera, the foldable fundoscope, but these designs I want to let it be free for everyone. So these are going to be CC-BY, that is Creative Commons attribution, but non-commercial. So CC-BY, NC. Some of them are NC, some of them are not. So you can use it, just attribute, just give credits to me that this was originally designed by myself, but you can use it.
Right. Thank you so much, sir.